Hi, this is Dr. Anna Lowe, and today I want to go over something that's super important for people who are struggling with issues like thyroid disease or fatigue issues, which is this really cool substance that we don't talk about enough in, modern medicine, which is iodine. Iodine is super important for antiviral, antibacterial, antiparasitic. It also breaks down mucous membranes and mucus production. And, as I'm reviewing, for my patients that I get who has thyroid issues, a big part of people who actually start treating with thyroid medicine, they don't necessarily feel better. A lot of times it's because they're actually deficient in iodine. And we actually, turns out, need both iodine and iodide in our body. We use so many parts of our body actually uses iodine and iodine. That includes our muscles, spleen, liver, thyroid, prostate, breast, blood, salivary gland, and intestines. And there are so many reasons why we actually low in iodine. WHO says that we are 75% of the population is actually deficient in iodine, and it is the number one cause of actually hypothyroid in these countries who don't have enough iodine. And the biggest reasons, and this is so important for why we go back to lifestyle and diet, and it's because the most common causes of deficiencies in iodine, number one, is because our ground is depleted of iodine, so it's not in our food as much. Our diet is low in iodine, which is commonly found in seafood, kelp, seaweed. For vegetarians, so important to have seaweed and kelp in your diet. Kombu, all the different kinds of seaweed in your diet. Inadequate use of iodine salt. I know we start using a lot more sea salt, which actually in effect reverses the benefits of having salt being iodized in most of the table salt. And also turns out diet that are high in pasta and bread, which is actually really high in bromide, that actually ends up binding into iodine receptors and actually blocks off our ability to have iodine benefits. And same goes for fluoride. By having too much fluoride in our system, it also again blocks the iodine receptor. And also, it's more commonly found in vegan and vegetarian diets, unless if you're more out conscious about having kelp and iodized salt in your diet. Other things include also, turns out sucralose, that are basically table sugar, also prevents good absorption of iodine. And there are many medications, for example, inhalers like Atrovent or Flonase, Flovent, which is very common now, especially in the Bay Area. If you have allergies, you might be using a lot of these because they contain bromide or they contain fluoride. And so turns out when you actually have thyroid issues, to make sure that you are giving enough iodine and start saturating the person actually ends up needing a lot less dosage of the thyroid at the end. And turns out there studies show that in areas there are high iodine salt, absorption, like in Japan, they actually have lower breast cancer rate too. And it's estimated that in the study done in 2002, it actually talked about, each breast, that the breasts actually need about 5 milligrams alone. The breast alone needs about 5 milligrams of iodine per day in a 50-kilogram women. So some good ways to get more iodine is actually supplementing it with kelp, table salts, but also Lugol solutions, iodoro tablets. There are ways, and just don't do it nonstop, but actually maybe just try to substitute it for 3 months, supplement of 3 months, and then start having healthy diets that include it regularly. There are problems with overtreatment, so you don't want to do that because it can cause thyroiditis, because it creates this immune response when this excess iodine binds to the thyroglobulin, and it actually creates this immune response that causes thyroiditis. So you definitely don't want it. And long-term overtreatment of iodine also can cause thyroid cancer. Don't want to do that. So I think that when if someone has thyroid issue, it's good to kind of treat them with iodine for a period of time, but really try to get it from a food source, a moderate food source. And that's really important. And that's my little information on iodine. So look to yourself and say, am I over, what's my diet like, and what's my intake, and am I getting enough sea vegetables?